I'm Dr. Salman Waqar, a GP, academic, and president of the British Islamic Medical Association, BIMA. We represent over 6,000 volunteer Muslim healthcare professionals who are as passionate about serving the communities they are part of as they are about caring for their patients, and we are proud to be supporting and to continue to be working closely with the Centre for Research Equity at the University of Oxford in helping to take forward the widely renowned learning and work around inclusive research through the principal and panoramic trials that took place during the COVID pandemic. Reaching out to underserved communities like ours is challenging and resource intensive. We have demonstrated how healthcare professional organisations and faith groups are able to be honest brokers, utilising the effective architecture that communities like ours have made. We were able to draw on this to help with recruitment for those COVID trials in ways that were engaging and meaningful to our communities. But perhaps more importantly, we introduced cohorts of our society to research participation for the very first time. Members of BIMA are of course the same people who experience differences in the way healthcare is delivered and the disparate health outcomes in their own lives and of those of their family. We are also activists and advocates for our communities, serving on boards and committees of our mosques, women's groups, youth groups, charities, and other organisations that meet the needs of our communities. Put all of this together, and recalling the fact that we are also embedded in the NHS and research communities through our day jobs, we have a profound understanding and are an asset that has seldom been tapped into. Because at the very core of what an organisation like BIMA does is to leverage the ability to create meaningful experiences through people of trust and influence, not merely through enthusiasm. And what may be surprising to some, very often in the ethnic minority communities that we reach out to, this does not even need to be done in a language other than English, because simply being from the same community and having had the same lived experience as the people that you are trying to engage with is often so powerful. And as we often say, the messenger is more important than the message. And what is particularly exciting about the work that the Centre is undertaking is the potential to create knowledge through research in areas that conventional methods have not identified. Because true equity will mean research priorities following the needs of the diverse people that we are trying to represent, with adequate resources to follow, of course, to restore parity. And what the Centre is trying to achieve is vital in that journey and is a breath of fresh air. Having such an initiative that can take advantage of the networks offered by the University of Oxford and the grassroots capital of organisations like BIMA will allow us to reach communities from diverse backgrounds and ensure that we generate evidence which is meaningful and representative. We at BIMA look forward to the riches that will be unearthed through this collaborative and the inclusive work that we are going to take, which will not only address inequalities, but will also bring benefit to all. On behalf of BIMA and all our members, I wish the Centre all the best and our ongoing support.